Are you a nurse educator wondering how you should prepare for a job interview? This video will review 10 tips for nurse educator with sample interview questions. Whether you're a seasoned nurse looking to transition into education or a new graduate passionate about teaching, this video is for you. Stay to the end for sample interview questions and answers. Tip number 1. Understand the role. Before the interview, thoroughly understand what a nurse educator does. They play a vital role in shaping the future of nursing. It is a good idea to review the National League for Nursing (NLN) competencies for nurse educators and the job posting you are interviewing for to understand the full scope of what you are expected to do. Types of nurse educator jobs include remote or online teaching, clinical teaching, classroom teaching, and hospital educator. If you would like to learn more about the roles of each educator, comment below to let me know. Tip number 2, highlight your teaching experience. Emphasize your prior teaching experience or mentoring experiences. If you are new, any education experiences count. This could be working with students at the hospital while you were a staff nurse, precepting new nurses, or helping the educator with a project at the hospital. Remember to update your CV to highlight these experiences. Tip number 3, be familiar with nursing curriculum. Familiarize yourself with the curriculum you'll be teaching. Knowing the program's structure can give you an edge. For example, review the program's curriculum from its website and understand the structure, courses they offer, and program length. You can even prepare a question about their curriculum to ask in their interview. It shows your interest. Knowing if the program is accredited and by which accrediting body is also a good idea. Tip number 4, showcase adaptability. Nurse educators need to adapt to changing educational methods. There might be new teaching and learning techniques that your program may adopt or want you to try. Share specific examples of how you've adapted in the past to new teaching techniques and what were the key takeaways from those experiences. It is also a good idea to familiarize yourself with current trends in nursing education. The NLN website is a great place to review what is happening in nursing education. For example, the use of artificial intelligence and its impact on education is a huge topic of conversation in the profession. Tip number 5, demonstrate effective communication. Clear communication is crucial in education. Make eye contact with the interviewer when speaking to them. Highlight your ability to explain complex concepts in a simple way. Remote or online teaching job interviews might ask you to send a teaching sample. This teaching sample might include you using technology where you present content using screencast software on camera, presenting your slides or screen. Classroom or clinical interviews might request that you present a teaching sample to the interview panel during the interview. Tip number 6, highlight your passion for nursing. Show your genuine passion for nursing and education. Share personal stories that reflect your dedication to the role as an educator. For example, if you were asked to present on a topic, select one you are passionate about and follow teaching principles to create and deliver a professional presentation. This will highlight your expertise and allow others to learn more about you. Tip number 7, research the institution. Research the educational institution thoroughly to understand its history and evolution. Show that you're genuinely interested in their mission and values. Reference their missions and values during the interview. Learn a little bit about the people you will meet at the interview by looking them up on LinkedIn or completing a Google search. This can help you connect with them personally. Tip number 8, ask thoughtful questions. Prepare at least 3 to 5 thoughtful questions about the role or institution to ask at the end of the interview. This shows your genuine interest in the institution and your engagement. For example, what does a typical day look like for an educator, you might ask? Can you please share a little bit about the working culture of this institution? Tip number 9, prepare for behavioral questions. Be ready for questions like, tell me about a time when. Structure your answers using the STAR method: situation, the task, action, and result. Interviewers like to learn more about you. The intention is to understand how you will respond to a situation, whether with students, staff, leadership, or another faculty member. If you're a new faculty with limited teaching experience, it is acceptable to say that you have not yet experienced that situation. However, use the opportunity to explain what you would do to handle the matter if the situation like that would come up. Tip number 10, practice, practice, practice. Finally, create a list of potential interview questions and practice your answers with a friend or a mentor. Always practice your teaching points to present at the interview. This will help refine your responses and teaching style by boosting your confidence. Take handouts of the presentation to the interview and have backup copies of that presentation in case technical issues arise. Now, let's move on to 3 sample interview questions and answers that you might encounter during a nurse educator interview. If you are finding this video helpful, please like, share, and subscribe for more valuable content. Please note that the sample questions and answers are for practice purposes, and real interview questions may vary. Question 1. Why do you want to become a nurse educator? The answer could be, I've always been passionate about nursing, and I believe that education is a powerful way to make a lasting impact on the field. I want to share my knowledge and inspire the next generation of nurses. Question 2. Can you describe your teaching philosophy as a nurse educator? A possible answer could be, as a nurse educator, my teaching philosophy revolves around fostering a learner-centered environment. I tailor my teaching methods to accommodate diverse learning styles, ensuring every student can succeed. I prioritize active engagement, critical thinking, and real-world application of nursing concepts. Additionally, I encourage open communication, collaboration, and lifelong learning to empower my students to become a confident and competent healthcare professional. You can even talk about theories, and if there's any theory that has contributed to your philosophy of teaching. Question 3. Can you describe a situation where you had to adapt your teaching methods to accommodate diverse student needs? A possible answer could be, certainly. In recent courses, I had a diverse group of students with varying learning styles and abilities. To address this, I implemented a flipped classroom approach. I provided pre-recorded lectures and online resources for self-paced learning, allowing students to review materials at their own speed. In our in-person sessions, I focused on active learning activities and discussions catering to varying learning preferences. This approach resulted in improved engagement and understanding among the students. Preparation is critical, so use these tips to shine in your interview. Thank you for watching, and best of luck with your interview. Subscribe for more content.